My name is Rikiya Cheaves, and I attend Manatee School for the Arts. I will be demonstrating the removal of a subdermal contraceptive implant. I will be using two models today, as you can see here, to better illustrate my technique. First, I will verify the patient's information by asking their name and date of birth and informing them about the procedure today. Now, I will sterilize my hands with alcohol. Then, I will palpate to locate the implant rod on the patient. Next, I will don gloves, and while I am doing that, I will specify that I am removing a Nexplanon implant, which was invented in 2010 and must be replaced every 3 years. A fun fact about Nexplanon implant rods is that they were designed to be radiopaque, or visible through an X-ray. Now, I will pick up dressing forceps and gauze. First, I pick up the gauze and apply the antiseptic solution to it. Then, I use the forceps to apply that antiseptic solution to the site of the rod. Before attempting to remove the implant, I ensure that the patient is in a supine position, and I instruct them to keep their arm ventral side up at a 45-degree angle away from their torso. Then, I will inject the site with the local anesthetic. Once the site is numbed, I will press against the implant rod and press the other end into the skin until a bulge is created. I then mark the area with a waterproof marker to ensure I know where to make the incision. Using a scalpel, I will make a 2 mm longitudinal incision at the mark in the same direction as the implant. And now with the better angle, I will show you that I'm using my fingers to push the implant towards the incision, and then I will gently nick at the fibrous tissue formed around the rod and simultaneously push it through the incision. I will carefully remove the implant rod from the incision using a pair of forceps. After removal, I'm going to close the incision simply by using an adhesive bandage. To secure the wound dressing, I will then apply gauze on top of the bandage. And finally, I will secure the wrapping gauze around the dressing. Next, I will advise the patient to keep the site clean and dry for at least 2 days and to keep the adhesive bandage on for a week. I place the used instruments aside for sterilization, as you can see here. I doff my gloves, and then I will wash my hands.